A radical new idea born out of a healthcare emergency. What to do about the #1 health crisis in America, not to mention the healthcare costs threatening to bankrupt the country. Today, two highly respected doctors in a major publication took a look at the millions and millions of America's seriously obese children, some weighing hundreds of pounds at an early age, and they suggested some of them should be taken away from their parents in order to save them. And here's why. In 30 years, childhood obesity in America has more than tripled. So Dan Harris tells us about this startling new proposal and asks the question, if lives are at stake, what would you do?
Harvard's Dr. David Ludwig, one of America's premier childhood obesity experts, says today in a prestigious medical journal that in certain carefully selected situations, some of America's estimated 2 million extremely obese children should be taken from their parents. Late today, we spoke to him via satellite.
Taking a child away from their parents is a drastic action. Should only be used as a last resort. But when we have a 400-pound child with life-threatening complications, there may not be any great choices.
ABC News heard from 24 experts, and all but 3 of them disagreed, including the ethicist Art Kaplan.
If you were a child who was morbidly obese and there was a real risk that your life was going to be drastically shortened, wouldn't you want somebody to come and save you and rescue you?
I'd say, can't you get someone in my house and make this a safe place for me? Can't you help my parents?
In fact, that is exactly what Dr. Ludwig proposes, that before removing an obese child from his or her home, state officials would provide the parents with counseling and education.
But is there any way to guarantee that state government officials will actually take the intermediate steps before they take that big step of removing a child from the home?
The state has no incentive to take a child away from their parents unnecessarily.
But he cannot guarantee they won't, nor can he guarantee that a child sent into foster care will actually improve. When Anna Marie Regino was taken from her parents in Albuquerque, New Mexico, she didn't improve at all. She was later returned to her parents and diagnosed with a genetic predisposition.
It did more damage to my daughter. If they really did care about that child, they would take more effort to stay with the family.
Dr. Ludwig admits foster care is not a perfect option, but he says one option we certainly do not have is inaction. Dan Harris, ABC News, New York.
So I want to bring in ABC's chief health and medical editor, Dr. Richard Besser. Rich, you know this area so well. Are we at a public health emergency level? This has to be addressed?
You know, Diane, I think this is an absolutely terrible idea. The solution is not to demonize parents. I think foster care would be a disaster. But I know the doctor who wrote this, and I think his primary goal's been achieved. He's issued a 4-alarm warning about this problem, and he's getting us talking about it.
So if foster care is way too far, what's the answer?
Well, one easy thing you can do, and I know it's going to sound simple, but no sugary sodas for kids. I think this is the #1 contributor. If you look at a child who's having 2 bottles of soda a day, over the course of a year, that can account for 50 pounds in additional weight. But it's not just the parents' problem, it's all of our problem, and I think there are things we can do. We need to get involved in the schools, make sure the cafeterias are only serving healthy food. We need to demand that our children have gym class every single day. And if you live in a neighborhood that doesn't have access to healthy fruits and vegetables, band together, take turns, have a designated buyer who goes to another neighborhood and buys those foods and brings them back. There are things that we need to do.
And we can do it together, a kind of neighborhood watch.
Exactly.
Together. Dr. Besser, thank you, Rich.
New information on a controversial story we first told you about Wednesday here on GMA. A prominent obesity expert generating a lot of outrage when he argued severely overweight children should be taken from their homes for their own good. ABC's Dan Harris has been talking to doctors and parents. I know I've heard a lot about this yesterday.
As you said, this is a hugely controversial idea, and the vast majority of experts we contacted disagree with it. And this morning, we're going to introduce you to one family that also disagrees based on painful personal experience.
It was a case that shocked many people in this country. 3-year-old Anna Marie Regino, weighing an extraordinary 90 pounds, taken from her outraged parents by government officials in Albuquerque, New Mexico.
Literally, it was 2 months of hell. It seemed like the longest 2 months in my life.
2 unnecessary months of hell. Anna Marie didn't improve at all in foster care. She was returned to her parents and later diagnosed with a genetic predisposition.
They say it's in the benefit of the child. It did more damage to my daughter than any kind of money or any kind of therapy is going to ever replace what they did to her.
Anna Marie, now 14, only agreed to speak to us if we concealed her face. Here's what she had to say about Dr. David Ludwig, the eminent Harvard child obesity expert who wrote that provocative commentary in a prestigious medical journal.
It's not right what he's doing, because to get better, you need to be with your family and have support instead of having doctors be surrounded by you.
This family has really never recovered from the trauma. What's your response to a case like that?
Well, state intervention is no guarantee of a good outcome. But to do nothing is also not an answer.
The doctor says children should only be removed in the most extreme cases and that state officials should first offer counseling and education to parents.
It should only be used as a last resort. But when we have a 400-pound child with life-threatening complications, there may not be any great choices.
Now, we should say, while many people oppose Dr. Ludwig's proposal, everybody agrees childhood obesity is a massive crisis in this country, with 2 million extremely obese children in America right now. That's the estimate. This doctor, at the very least, got us talking.
Got us talking, but do you want 2 million in the foster system that has its own issues?
Now, he has said very clearly, not 2 million kids going into the foster care system, only in very, very extreme cases.
All right, but like you said, got a lot of people talking.
He did.
And we're going to get more people talking, Dan, because we want to know what you think. Should parents lose custody of extremely obese kids? Vote now using the GMA app on your iPhone or Android phone, and you can also go to our website, abcnews.com/GMA.
Commentary, the nation's leading medical journal this morning, calls for parents of obese kids to lose custody of those kids. The controversial article is in today's Journal of the American Medical Association. It argues for state intervention for removing overweight children to help them lose weight. According to the article, there are 2 million children in the country who are extremely obese, and despite the discomfort posed by state intervention, it may sometimes be necessary to protect a child.
The kid is 400 pounds and needs surgery, then as a very temporary last resort, but it wouldn't be my first choice.
No, they shouldn't be taken from their family. It won't solve the problem. You teach them, you educate the kids, you teach them what to eat.
Well, the article does not address all the realities of such a policy, like the costs or where the children will be treated or when they could go home.
County officials say they learned about the 200-pound 8-year-old's weight and health problems from the medical community.
This was a case of medical neglect, in the opinion of healthcare professionals, that this child had some severe conditions that, if not dealt with differently than his family had been able to up to that point, could be life-threatening.
Department of Children and Family Services Administrator Pat Rideout said they worked with the family for more than a year to get the third grader's weight under control through programs and counseling. With little or no change in the boy's health, Rideout said they had to contact the court and take a, quote, more intrusive approach. The boy was taken out of the home and put into foster care.
It was very, very serious. This is not a simple case, an easy case, but a child who was at very, very serious risk.
Some parents I talked to say it was the right thing to do.
I think it is medical abuse, because she should have took more time out to take care of her child.
Others worry the big changes could do more harm than good.
I don't think that's right. They probably needed to put help the kid out, but not by taking him out the home. That's not helping.
Family law specialist Stephen Slive was surprised by the move.
Usually the county doesn't get involved unless it's a much more serious infraction.
But said it was the right call and stressed foster care isn't permanent.
Any kind of neglect case like this, the law is to reunite the parents and the child. So this is sort of temporary.
We hope that we'll be able to work with this family so that they're better capable of meeting this kid's needs so that he can get home and be healthy.